Hi, I'm Dr. David Zahalik, and today we're going to talk about the answer to the question, what should I say to my doctor at the next visit? Nowadays, there's a lot of time pressure to get information communicated as the doctor gets in and out of the room, and both doctors and patients feel it. But the quality of the information that is exchanged back and forth is going to have everything to do with the treatment plan. 85% of the diagnoses that we doctors make is based on the history, what's said between doctor and patient, and sometimes even how it's said. Although we use lab tests and x-rays and other kind of diagnostic tests, it's really what's said that makes the most difference. So to get the most accurate treatment, you definitely want to give the best history you can. Now, I find one thing that's very helpful to share with patients is if you have a concern about a symptom you're having, maybe it represents to you something that could be serious, bring that up front. If you're worried that you have cancer or a heart attack based on your symptoms, tell your doctor so that they can properly apportion their time to spend a little time to talk to you about what the symptoms mean and any tests that need to be done. That's important. Another very useful thing to do is to use a health journal. So a health journal is just a record that you keep with you where you write down things like your blood pressure or blood sugar, if you check that, your medications and when you take them, any side effects or symptoms you feel, and any questions that you have. Well, if you bring that with you, you'll be more organized and ready with your questions. One word of caution, though. If you bring 8 or 9 or 10 things to be answered in a 20-minute visit, one of two things is going to happen. Either you're not going to get your questions answered, or you might get them answered, but there may not be enough time to get the right quality answers you want. The last thing you want your doctor to do is to be rushing or guessing, so it's good to allocate enough time to get the problems resolved appropriately. And the body is a very complex thing, so sometimes us doctors don't have the answer in just a minute, although most doctors work very hard to get you the best answer possible. Now, at the visit, make sure to bring all your medications with you. That's very important. You may have stopped a medication and there may not have been communication with the office, or you may have started a new over-the-counter medication, and your doctor needs to know that to interpret your symptoms and to decide on whatever treatment may be prescribed. So that's important. And also, if you need refills of routine medications filled at the time of the visit, let the office know up front so that doesn't slip through the cracks. Now, if you're working with your doctor on a new problem, make sure that you understand what he or she is thinking as to what the cause is. And sometimes they'll tell you, here's the diagnosis, or sometimes they'll say it's one or two or a number of things. We have to work through that list of possibilities. But you'll be more in sync with them if you know what they're thinking as to the cause of the problem. And also, can you do something about it that doesn't involve taking medications? Some problems are simple and don't require medications. Or sometimes you can help your condition in ways that don't involve taking medications, whether it be diet, exercise, physical therapy. So it's always important to ask, what can you do besides just taking medications to get better and to stay better? Now, if you have to have diagnostic tests done, make sure you get a couple of questions answered. One of which is, where am I going to get this test done, and by when should I get it done? Timelines are often very important in doing these tests, so make sure you know what your doctor is thinking there. Also, what are the risks of the test that's being proposed? You have a right to know any risks associated with it, and you'll be required to give informed consent before you do any test anyway. So make sure that you're okay with the risks. And if you're not, just ask the doctor, is there another way to get this information and make this decision? Often there is more than one way, but talk to your doctor about that. And then also ask, what's the next step after I get the test completed? The tests are done to help decision making, so you'll have to kind of circle back and communicate with the doctor's office or they with you to figure out, how to move the treatment plan forward. So ask about what's the next step. And finally, if you are starting a new medication, inquire if there's any conflicts between that medication and your existing medications. Always good to ask. Ask what happens if you have a cost issue. If you get to the pharmacy and the medication's not covered or not affordable, what is your doctor expected to do as the next step? And that's a situation that often occurs, and if you have a plan, it's easy to deal with. And then the final thing is, if you're starting any routine medications, make sure you know the follow-up cycle for that, because follow-up is very important when you're taking medications, to make sure you're not having side effects, to make sure the drug is working, and you're not taking too much or too little. So those are some ideas on how you can make your doctor's office visits more useful in terms of time and quality of conversation. Thank you.